I'm Dr. Eddie Barovic, Medical Director of Travelvax Australia. I'll be demonstrating the use of the BioLine SD Malaria Rapid Test Kit. The kit comes pre-packaged like this, and I've opened one up, and inside it you'll find the instruction leaflet with step-by-step instructions, an alcohol prep pad, a lancet to take blood sample, a glass pipette to collect the blood sample, the actual test pad on which we do the test, and a reagent. When you open the test kit, inside you'll find a silica gel, and you have to make sure that these crystals have not turned green. If they have, then the test kit can't be used. So to start, first thing you need to do is take a blood sample. You just take your alcohol prep and prep a finger, get the lancet, remove the top of the lancet, and then firmly jab into the finger and squeeze to get your blood sample. Take a hold of the glass pipette and just hold it to the blood sample. It'll collect a 5 microlitre blood sample. That is then placed into the well of the malaria kit. It's this well here. So we just place that in there. Then get a hold of the reagent. Remove the top. And we put the entire contents of the reagent into the reagent well. Once we've put the reagent into the reagent well, we just leave the test strip aside for up to 15 minutes before we can actually read the result of the test. Okay, 15 minutes have passed and now we can read the actual result of the test. When it's time to interpret the result of the test, we look for lines under the C, the PAN and the PF. You must have a line under C for this to be a valid test. If there is no visible line under C, then the test is not valid. If there is a line under C and PF, then that's a positive test for Plasmodium falciparum infection. If there is a line under C, PF and PAN, that's also a positive test for Plasmodium falciparum infection. If we have a line under C and also a line under PAN, but no line visible under PF, then that is still a positive test, but it indicates an infection with a Plasmodium species other than falciparum, presumably Vivax malariae or ovale. It's important to remember that even a very faint line is still regarded as a positive line. If we just have a line under C and no lines under PAN or PF, such as the case with this test that I've done on myself, that's regarded as a negative test, and it's unlikely that there is infection with malaria. Nevertheless, if symptoms persist, a repeat test should be done or medical attention sought. If the test is positive, that indicates infection with malaria, and that needs to be treated immediately. In your malaria pack is a packet of Riomet. This is the medication you take to treat malaria. With it is some dosage instructions. It's important you follow the dosage instructions carefully and take the entire course of medication. After completing your malaria rapid test and commencing your treatment for malaria, it's important that you seek medical attention. Now you should know how to use the malaria rapid test, but if you have any further questions, please visit the Travelvax Australia website. Thank you.